Hey everyone, welcome back to Teeth Talk with Dr. Joe and Whitney. So we're really happy today. We're just doing really fun. It's going to be ways to explain things to your patients. We have some cool analogies that we're just going to share with you. When a patient says, why do I need this gum treatment? Like, my teeth are fine. I say you wouldn't want to build a house on a rocky, unstable foundation.
Build up, post, and core. So patients always ask why they need a build up and a crown, and a good way of saying it is that you have to think about stability, like kind of like the foundation again. And a patient needs a post core when they don't have enough ferrule in the tooth, meaning there's not enough tooth above the gum line to support the crown. So the way I always explain it is you need a head to put a hat on. So if your neck was at the gum line and you try to put a hat on your neck, it's just going to fall off. So you need a head on it. And that's what the post and core does.
Okay, I'm gonna do fluoride varnish. Especially kids ask me, what is that? And I always compare it to clear nail polish. It's like I'm putting nail polish on your teeth, and I say, but it's vitamins. So it's like clear nail polish with vitamins. You're not gonna see it, but it makes your teeth nice and healthy.
All right, and then since we just talked about post and cores, now we should talk about the difference between a post and an implant, because patient will be like, oh, I have an implant, but then they'll point to a tooth that has a post and core in it. An implant is what actually goes into your bone. The post and core is something that goes into a root canal of a tooth. So to get a post and core, you need to have a root canal first, and then a little screw goes down the root, and that will retain your core, which sticks out of your gum line, and the crown that goes over that. An implant, you lose your tooth, and then the implant goes into the bone, and that'll support a crown.
This is an anatomical question. What is the cusp? I've had that question a lot, and I just say it's the little mountaintops on the back teeth.
All right, so why do I need to get bone grafting before my implant? I always tell patients, if you're gonna hang something heavy on a wall, you don't put the screw in a drywall, you put it in a 2x4. Bone grafting's the 2x4.
Okay, scaling. A lot of people get nervous when they hear scaling because it sounds really intense. It's like raking, you rake with a rake, right? Mopping, you mop with a mop. Scaling, you scale with a scaler. So it's just a way to clean the plaque off your teeth. It's not a scary thing at all.
All right, so you'll hear me say, get the Garrison or get the Toffelmeyer, and those are matrix bands. Matrix bands, kind of like a cake pan. So if you're doing a filling on an interproximal surface and you're losing the surface that's touching the adjacent tooth, you just don't want to put a filling in, or else it'll attach to the tooth next door. So a matrix band will contour and separate the filling from the adjacent tooth next door, so you can build nice contact. So when you floss, you'll get a nice pop.
We actually have a video on that, which I will link in the bottom or below. It's an interproximal filling being done by yours truly over here. I'll link it. Another dental word is enamel, and quite simply, it is like an eggshell on top of an egg. Is that a nice way to say it?
All right, so you tell someone they need to get a root canal and they don't quite know what that means. You take a lead pencil and you remove the lead out of the pencil. You still have the pencil, it just isn't really living anymore without the lead.
So a fun one to explain the difference between para pockets and healthy pockets, sulcus, is form-fitting scrubs are your healthy, tight pockets, like in a nice jogger, and a perio pocket is like those huge scrubs. That's a fun one.
Why do I need to get x-rays? Someone might say they don't want them. Well, if you take your car to the shop, the mechanic is going to have to lift the hood up. If you tell them, you can lift my car up, but you can't lift the hood up, they're not going to be able to see what's going on in the engine. The inside of your tooth is like the engine with the nerve, so the x-ray allows us to lift the hood and see what's going on in there.
Totally. And on that same car mechanic deal, same thing with routine cleanings. If you come in every 6 months or whatever your recare is, and we are constantly checking everything and maintaining and seeing that everything's at bay, you are less likely to have a real random scary situation happen with a tooth. That's kind of like the same as routine oil changes, right? You get oil changes, they'll let you know, ooh, maybe your tires are getting a little rough, like maybe you gotta think about that in the future, you know, instead of just having a busted tire one day because you haven't been to the mechanic in so long. So that's the same. Our little analogies.
Gotta maintain this machine.
This machine! Thank you all for watching. I hope this video helped you. Please like and subscribe if it did. If you want more Teeth Talk, you can visit the website, teethtalkgirl.com, where we have articles and videos about healthy mouths and healthy teeth. Peace, love, and teeth.